podcast where we do a podcast about everything related to your gut and your GI tract. If you're joining me for the first time, my name is Dr. Islam. Who am I? I'm a board-certified gastroenterologist trained at the Mayo Clinic. I've been in practice for over 10 years. I've treated thousands of patients with all sorts of gut issues. I've been doing this for a long time. I published numerous papers on this topic. I'm considered an expert on these conditions. Every Monday, I do a podcast where I do a deep dive to answer questions you have about your gut health. And if you can join me live on the live streams on my social media channels, answer questions you guys have as well. And thank you for joining today on our podcast today. We have a great show today. We'll be doing a deep dive about pancreas issues, mainly pancreatitis. I have seen a number of patients who've asked me questions about pancreatitis. So I want to do a deep dive about this topic. We'll talk about some signs that you may have about IBS or bowel syndrome. We'll talk about Mike Tyson and his diagnosis of an ulcer. What does that mean? And there was a recent congresswoman from Texas who got diagnosed with pancreatic cancer. We'll talk about that in any of your live questions as well. So let's begin on the first topic, pancreatitis. So what exactly is pancreatitis? So pancreatitis is inflammation of your pancreas. Your pancreas is an organ right in the middle that can typically is used to help produce digestive enzymes to help digest foods and digest substances. The issue when it comes to your pancreas is that it is typically a silent organ, but when it acts up and becomes angry, that is when the problems can occur. And that is typically when a lot of my patients have issues. And so one of the more common symptomatology of an pancreas acting up is what's called pancreatitis, which is inflammation of the pancreas. This is when this organ that sits right here gets inflamed and gets irritated and can manifest in different ways. So what are reasons why people can get pancreatitis? Well, there's a mnemonic that we use in med school called GET SMASH. GETSMASHED. I'm all about mnemonics. They've helped me out through med school, and these actually produce the most common questions of people have pancreatitis. So the first one is gallstones. So if you have a gallbladder and you have stones, having gallstones is probably the most common cause for developing acute pancreatitis. And typically that stone will get lodged in the ducts of the pancreas or around the areas around the pancreas, and that can cause backflow and irritation of that pancreas to occur. And that commonly can cause that to be the case. That can cause irritation to occur there. Oh, we're having some, well, let me check something. Sorry, I'm having some technical issues, so give me one quick second here. Let me check something out. Well, that's what happens when you do a live stream. Sometimes you get these technical issues here. So let me find out why it is not recording here. If not, we just may have to switch to this device, which is fine. The picture quality is not as good, but it happens sometimes. Let me see if I can fix this up in the background. All right. So we talk about gallstones. Gallstones are actually one of the more common causes for developing acute pancreatitis. You have these gallstones actually form around the gallbladder. They can go in the ducts and cause inflammation to occur. That's the first reason. Number two is alcohol. Alcohol very commonly can cause pancreatitis. So as you drink alcohol, not only is it a direct toxin to your body, it can also be a direct toxin to your pancreas as well. And that can cause irritation to occur and cause inflammation to occur as well. The other one on the T is trauma. So actually getting hit in this area can cause pancreatitis to occur. This is common in car wrecks. So you're driving around and all of a sudden, you get into a car wreck and you get hit right here in the chest. That can cause pancreatitis to occur. Another common reason can also be sometimes scorpion stings. There are specific scorpion stings that are known to cause pancreatitis. So we're going to get GETSM. So sometimes some infections can cause pancreatitis to occur, like mumps, for example, can be a cause for an infection. GETSMA. So sometimes some things like certain antibiotics can cause infections or pancreatitis to occur. You get an antibiotic, actually causes irritation of this area inside your upper chest, that can cause inflammation and irritation to occur as well. But the most common ones by far are alcohol and gallstones by far. So how do we diagnose pancreatitis? This is the key thing, because pancreatitis needs 2 out of the 3 symptomatology, you actually have a diagnosis. You need 2 of these at least, meaning if you have 1 of them, you actually don't have pancreatitis. You have to have 2 out of the 3. So one of them is that you actually need to have imaging tests, like an ultrasound, to show kind of irritation in that pancreas. And that's a common reason why you can have pancreatitis, is having that inflammation that's there. Number 2 is that you can have a lab value like an amylase, specifically lipase, that's 2 or 3 times the upper limit of normal. This is another reason why you can have pancreatitis, or another diagnosis of pancreatitis. And then number 3, you need to have exam findings that are consistent with pancreatitis. So that typically is pain that goes right to your back. So pain in your back is not pancreatitis. Pain only in your belly is not pancreatitis. Pain on your left side is not pancreas pain, and pain on your right side is not. Typically it's epigastric pain that goes straight to your back. And this is a very common cause, or very common symptomatology of acute pancreatitis as well. So keep in mind, you need 2 out of the 3. You need imaging testing, you need blood testing, or you need physical exam findings. So if you have a blood testing that's consistent with acute pancreatitis, and you add that plus the physical exam findings, that gives you a diagnosis of pancreatitis. Or if you have imaging testing and blood testing, but not the physical exam findings, that gives you the diagnosis of acute pancreatitis. So you need 2 out of the 3, not just 1, and you don't need all 3. So what do we do to treat pancreatitis? The first thing we need to do is that we need to give you fluids. What happens when you have pancreatitis is that you have so much inflammation going on that you actually need the fluids to kind of wash away that inflammation, those digestive enzymes. Whenever you have pancreatitis, your pancreas actually secretes out digestive enzymes, and it will auto-digest itself to cause irritation and causing worsening symptoms from the pancreatitis in the future. And so you actually need fluids to wash off those digestive enzymes to give you the capabilities to make sure you can heal yourself. And it's a lot of fluids. It's not just a little bit, but it's a lot. You're giving liters and liters and liters of fluid. The second thing you want to do is that you want to try and do early feedings as early as possible, meaning you want to try and give you food down your mouth as quickly as possible. In the past, we used to think that we need to keep these patients without any food. That has not been shown the case. Studies after studies have shown that the early feedings you give for patients who have acute pancreatitis, the better they're going to be. The better they respond, the better they recover, and the less mortality or death you can have. So early feedings is critical when it comes to pancreatitis. Do you need to give antibiotics? Typically not, especially for routine pancreatitis. So if you're in the hospital and you're getting antibiotics, there should be another reason for that. And then lastly, you need to find out the cause. So if it's a gallstone, you need to get your gallbladder out. If it's alcohol, you need to stop that. If it's other inciting causes, you need to make sure we can resolve that, because there is going to be an excellent chance that the pancreatitis will come back in the future. And when it does, it can typically come with a vengeance and cause a lot more problems and cause significant and serious complications down the road. Now, patients always ask me, hey, Dr. Islam, I've had 1 episode of pancreatitis. What are the chances of me getting another episode of that? And that's a good question. And unfortunately, we don't have a lot of good data for that. So obviously, if you have your gallbladder or gallstones as the cause, you removing your gallbladder is going to pretty much negate that cause. If it's alcohol, same thing. If you had alcohol as the cause for your pancreatitis, you need to stop drinking. That's not going to be the case. If we don't know, though, why you have pancreatitis, we don't really quite understand why some individuals can maybe have that. So we may do further testing to find out why. That includes doing what's called an MRCP, or an MRI of your ducts around the pancreas, to see if there's a small little lesion or a cancer that's there. Sometimes we can do what's called an endoscopic ultrasound as well, which allows us to kind of see if that's the case as well. But this gives us an opportunity to find out what could be the true cause of why you have pancreatitis, but also make sure we're not missing anything obvious when it comes to dealing with your pancreas issues. The pancreas is an organ in which you don't want to mess around with. It is scary what can happen whenever you do mess around with it, or whenever you can have complications from it, because it's severe pain that typically can be hard for us to treat and to resolve. And so whenever somebody has pancreas issues, we always want to make sure we find out why, deal with the issue, and hopefully get that taken care of for them as well. So this is my deep dive on pancreatitis. I have a couple questions out there. Christina asked, can you still get stones after your gallbladder is removed? Yes, I love this question. And the answer is yes, you can. Absolutely. There are so many patients who still form stones even after you get your gallbladder removed. Getting your gallbladder removed does not minimize or negate your risk for developing stones. So absolutely, you can still form stones. It commonly happens. And so if you're having similar pain and you've had your gallbladder removed, absolutely get an imaging test or maybe some blood testing so we can find out exactly what's going on and make sure you don't have a stone that's there. It's a great question. Absolutely, you can. All right, if you're joining me for the first time, my name is Dr. Islam. I'm a board-certified gastroenterologist trained at the Mayo Clinic. I do a podcast every Monday where I go and also go live on my social media streams. If you haven't already, don't forget to smash that like button, like, share, and subscribe if you're watching on the live stream. Also, let me know if you're watching this live or on the replay as well. So I got another question from a patient. Hey, Dr. Islam, I think I have IBS. How do I know? Well, in this video right now, I'm going to give you 7 kind of symptoms or signs that you actually may have IBS. So we can hopefully get a better idea if that's the case. So sign number 1 is that you have abdominal pain. Without abdominal pain, you typically cannot have IBS. You must have pain with that. And the pain typically will get better with a bowel movement or having some bowel habits. So having abdominal pain that tends to get better with bowel movements gives this a sign that you may have IBS. Number 2 is you have a lot of bloating and a lot of flatulence as well. This is also another common symptom and sign that you have IBS. You feel like you're bloated all the time, you can't get anything out, or you're feeling distended all the time. It's another common sign that you have IBS. Number 3 is that you can have a change in bowel habits. So having a change in bowel habits commonly can be associated with it. In fact, it's a hallmark for IBS. Some people feel that urge or that urgency to use the restroom. That's also associated with this spectrum of having IBS as well. And for some individuals who may have constipation, they actually may have that feeling of incomplete evacuation. They can't get everything out. And that sensation of not getting everything out can be also a hallmark of IBS. And commonly with a lot of my IBS patients, you actually may notice that change being almost like mucus type stools. Like you have mucus in your stools. This is a very common normal finding in IBS, so I do see this in other individuals as well. Sign number 4 is significant other symptoms like nausea and heartburn. Chronically, my IBS patients also have nausea and reflux associated with them as well, which can make their symptoms feel worse, also make them not feel good as well. So it's not uncommon to have other symptoms that are associated with that. Number 5 is that you can have constipation and or diarrhea or both, even in the same day. So there's different spectrums of IBS that you can have. You can have IBS-D, which is mainly diarrhea. You can have IBS-C, which is mainly constipation, or you can have a little bit of both, IBS-M. And so depending on the symptomatology, this will determine for us exactly which route to go down when it comes to your IBS. And those individuals that do have IBS, this is a very common symptom to have that as well. Number 6 is that you can certainly have symptoms that are triggered by stress in certain foods. So IBS for some individuals can be a food-related symptom or diagnosis. Now, it's not for everyone. And this is why I have to stress is that some patients, you treat their diet and they feel so much better with their IBS. For others, you don't, and that is okay. Not everyone is the same. The most common food triggers when it comes to IBS include things like dairy, gluten, or what I call high FODMAPs. These are the most common triggers when it comes to IBS. And sometimes removing those foods can make you feel better. It can give us the diagnosis of IBS. But also stress plays a role. Absolutely, stress plays a role. In fact, stress plays a significant role when it comes to all sorts of gut issues as well. And so having symptoms that are triggered by stress can also give you a thought that you may have IBS as well. And for my female patients, number 7, if your symptoms get worse during your period, this actually may be a sign of IBS as well. For a lot of my patients, their gut symptoms just get worse and worse and worse whenever they're in their period area. And that can be related to the hormones that are released during your menstrual cycle, which can be a sign or symptom of IBS. And so if you have these symptoms or sign, come see us where we can find out what's going on, because there's a lot of other treatment options that we can do to hopefully get your IBS taken care of and get you feeling better as well, and hopefully resolve some of the issues that you're having as well. And it's very common for that to be the case. And usually we can offer treatment options to get our patients feeling better. So if you're joining this channel for the first time, my name is Dr. Islam. I do a podcast every Monday where I give you a deep dive on a topic. And I also do questions based on the live stream as well. If you haven't already, don't forget to smash that like button, like, share, and subscribe. Let me know if you're watching this live or on the replay. Also, let me know where you guys are watching this at as well. If you're listening to this on the podcast, don't forget to give us a 5-star review as well. So I'm going to try and do something different. I'm going to try and let's see if this works here. Obviously, if you're listening to the podcast, you won't be able to see this, but if you want to learn more, don't forget to go to my YouTube channel where you can get more information like this. I'm going to try and do a reaction video to something I saw on on social media. Let's see if I can pull this up here. There we go. So I saw this on Instagram where an influencer was giving a recommendation for constipation. So let me know in the comments down below if you can see this. Obviously, if you're listening on the podcast, you won't see this, but hopefully the noise will be a-okay. So let me see if I can pull it up here. Let me put the volume up, and I'll give you my thoughts on this cure for constipation.
This works every time in about 5 minutes. Grab a navel orange. It must be navel. Wash the outside really well, then slice it into sections. Generously coat with cayenne pepper and cinnamon. There's actually science behind why this works, which I'll include in the description below. Next, eat the entire wedge, skin and all. Take note.
All right. So I'm hoping that you guys were able to see that or hear that. Let me know in the comments if you were or not. So let me tell you my thoughts on this. So number one, we really don't have any science that having an orange peel is going to give you more fiber than not having an orange peel. So all that peel is doing is it's adding fiber to your diet, which is perfectly fine. Now, if you want to add in cayenne pepper and if you want to add in cinnamon, that's perfectly fine. But that sounds like a terrible idea because that's going to stimulate the pain receptors in your gut. Now, that may kind of move things along because you want to get things out, but that's also not the best way or the best food when it comes to dealing with constipation and bowel habits. So let me tell you, if I was going to give you a recommendation for what food that I recommend to get you going and flowing, we have better evidence for certain foods, mainly kiwi and prunes. These two foods have been shown in clinical trials to help out when it comes to constipation. Absolutely it has. And using this is a more effective way to get you going and flowing. And so I would not necessarily agree with the recommendation of using a orange or pepper or cayenne. But if you want to try kiwis or plums or prunes, they actually do work. Now, I have seen some social media videos of people using dragon fruit. Now, if you want to try that, let me know. If you see videos like that, let me know in the comments as well, because this may be something. It's a new segment that we're doing where I'm reacting to social media trends or videos. Let me know what you guys think, and let me know if this is something that you want me to continue doing as well. All right, next topic, Mike Tyson. So you may have seen in the news that Mike Tyson had to delay his fight with Jake Paul because he developed an ulcer. So the question is, what was going on? So obviously I am not Mike Tyson's doctor. I'm not going to give you, I don't know what's going on with him, but let me tell you about what could be going on. So ulcers are irritations in the stomach lining that can cause pain, nausea, poor appetite. It can actually bleed as well. Now, there are a lot of reasons why people can develop ulcers. Sometimes it can be from stress, but sometimes it can be certain medications that you take. So things like Aleve, naproxen, Advil, Motrin. These are common causes of ulcers in the stomach, and sometimes taking that can irritate the lining of the stomach to make it more likely for you to develop an ulcer. You can also develop an infection in your stomach called H. pylori. So H. pylori is a bacterial infection in the stomach that very commonly can irritate the stomach to cause ulcers to occur as well. So how do you know if you have an ulcer? Well, number one is pain. Pain right here in your upper belly. That pain right there in the upper belly can be pretty severe to the point where you just have a lot of just discomfort. You can't move around. Who knows if this happened with Mike Tyson or not? A second reason, especially if it's bleeding, is that if you have black stools. So black stools are never normal. You don't ever want to have black stools. And if you have black stools, what we do worry about is that ulcer bleeding, or is there something going on? And so if you have black stools, if you have pain, if you have poor appetite, or you don't understand why you're having some nausea and vomiting, that could be a sign of an ulcer. So what do we do? If I think you have an ulcer, I want to see what's going on. And so I will do what's called an upper endoscopy, or an EGD. We'll use a very small camera, take a look inside that esophagus, and I can see what's going on while you're asleep. And with that, I can check to see if you have an ulcer. I can check the cause for it. I can check for any irritation and inflammation to find out if that may be the reason as well. And if you do have an ulcer, we need to put you on treatment. Now, treatment can range from medical therapies to sometimes stop the inciting event, to sometimes maybe give you antibiotics to treat the infection. So if you feel like you have an ulcer, don't forget to come see somebody for that so we can investigate what's going on and hopefully get a better idea of why you have the ulcer, but also what we can do to treat that as well. All right. So next topic, pancreatic cancer. So Representative Sheila Jackson, I believe from Houston, just got diagnosed with pancreatic cancer around the age of 70 years old. Now, pancreatic cancer, unfortunately, we are seeing more and more of pancreatic cancer, not necessarily because there's a rise of this cancer, but because we are noticing it earlier than what we did before. More and more individuals we're finding pancreatic cancer because we're doing imaging tests for other reasons. So, for example, I had a recent patient come to see me who had a CT scan done for a hernia, and on that CT scan, they found something on the pancreas that is a concern for something growing in there. And this is how we're actually finding pancreatic cancer. And this is actually the best way for us to find it, because sometimes in that situation, we can find it early and intervene before it becomes something bad in the future for you. So sometimes doing imaging tests for another reason can give us the answer for what is going on inside that pancreas. Now, if there's a concern for a lesion in the pancreas, we have to find out, is that the case? And so sometimes we'll do further imaging. Sometimes what's called an MRCP or an MRI of the pancreas can give us a better idea of exactly what is going on in that area. Sometimes we have to do what's called an endoscopic ultrasound, where we go down with the small little scope with an ultrasound machine, see what is going on in that area, maybe get some samples of what is going on there as well. And sometimes that can be the case as well. And if you have, if there is a concern about pancreatic cancer, the treatment is going to depend on the stage of that. So if it's localized to one area, we can just remove that part. It's a pretty significant surgery, but we can remove that part plus other parts, and we can kind of put you back together, and that will resolve it. But unfortunately, in most cases, by the time we find it, it already has spread. And this is the issue about pancreatic cancer, is that it does not cause symptoms until it's too late. And that can be very, very scary. So sometimes those symptoms may be you're having a little bit tired, fatigue, poor appetite, yellowing of the skin, white yellowing of the eyes, white stools or clay-colored stools. These are pretty non-specific, and sometimes multiple things can cause that. But by the time you already have these symptoms, sometimes it's too late. So this is why sometimes getting imaging tests for a different reason can actually allow us to find the lesion and hopefully get that taken care of you. Now, there are some risk factors that we do know can lead to pancreatic cancer. So if you have a first-degree relative, mom, dad, brother, or sister, they'll put you at higher risk of developing pancreatic cancer. If you smoke and drink, that is almost like quadruple whammy to your colon, to your pancreas, to cause pancreatic cancer. Smoking itself is a risk factor. Alcohol itself is a risk factor, but both combined are significant risk factors when it comes to pancreatic cancer as well. Now, if you're worried that you have pancreatic cancer, sometimes we'll do some simple imaging tests like an ultrasound to kind of see what's going on. And if you're at high risk, we may want to consider doing both an MRI or what's called an endoscopic ultrasound, so we can actually get down to the cause for what is going on. All right. Perfect, guys. Well, I think this is the end of our podcast. But thank you for watching. If you like what you see, if you like what you hear, please give us a 5-star rating. Give us a like, share, and subscribe. Don't forget to subscribe to my channel, my YouTube channel, my Instagram, my Facebook channel. And if you want to learn more information, come see Slow Gastro for all your GI needs. I'm sorry about the sometimes the technical errors, but that's okay. It happens. And as usual, we'll hope to see you guys on future videos. Let me know what you guys think about this new format by doing some reaction videos. I'd love to continue doing that, and let me know what you guys think. Thank you for watching. Hope you guys have a great and happy day. Take care.